Good day everyone. In this short video, I will be presenting to you an overview of Aztreonam, a monobactam antibiotic with selective activity against aerobic gram-negative bacteria. And this presentation will walk you through the key aspects of Aztreonam, including its origin, structure, mechanism of action, resistance issue, and also the cost considerations. Firstly, Aztreonam was first isolated in the 1980s from Chromobacterium virulensium. It is unique among beta-lactam antibiotics due to its monocyclic structure that contain only a single beta-lactam ring, and this structural feature contribute to its selective activity against gram-negative bacteria such as Pseudomonas species, while generally sparing gram-positive and also anaerobic organisms. Besides, Aztreonam exhibit high affinity for protein-binding protein 3, or we call it as PBP3, which is crucial in cell wall synthesis of aerobic gram-negative bacteria. It is also considered bactericidal, meaning it can inhibit and kill bacteria at relatively low concentrations. Another important property, it is stability against many beta-lactamases, although it is not resistant to all, include some extended spectrum and carbapenemase producing enzymes. And as Aztreonam is typically administered via intravenous injection, known under the brand name Aztreonam, or inhalation in patient with a cystic fibrosis under the brand Casten. Next, Aztreonam works by inhibiting bacterial cell wall synthesis. It binds specifically to PBB3 site, disrupt the final stage of peptidoglycan cross-linking, which leads to cell lysis and death. Its selective action against gram-negative aerobes make it is effective against organisms like Pseudomonas aeruginosa, E. coli, Klebsiella pneumoniae, and also Haemophilus influenza. It is ineffective against gram-positive and anaerobic bacteria due to lack of binding affinity or structural barrier. However, resistance to Aztreonam can develop through two primary mechanisms, which is the first one is enzymatic degradation, especially by beta-lactamases such as ESBL-S, EMPC, and also carbapenemases, which can hydrolyze and inactivate the drug. The second one is mutation in PBB3, reduce the binding efficiency of the drug. And common resistant organisms include ESBL producing E. coli, carbapenemases producing Enterobacteriaceae, and also multi-drug resistant Pseudomonas aeruginosa. And it is important to note that although Aztreonam is often stable to many beta-lactamases, but some are resistant to enzyme, especially metallo-beta-lactamases, that render it ineffective. Lastly, cost is another important consideration, especially when deciding between formulation. The injection formulation, which is Aztreonam, is moderately expensive and is typically used in hospital setting for short-term treatment. The inhaled formulation, which is a Casten, for example, used in patients with a cystic fibrosis, is significantly more expensive. In the United States, it costs can exceed $10,000 to $20,000 per month, and in Malaysia, while exact pricing can vary by institution and supplier, that will access may be limited and cost may depend on insurance coverage or public healthcare funding. To conclude, Aztreonam is a valuable antimicrobial agent due to its narrow spectrum, beta-lactamase stability, and also efficacy against gram-negative pathogens. However, its clinical utility is limited by resistance mechanism and also cost, especially for long-term use. I think that's all from me. Thank you.